Hello everyone, myself Priyanshi Patel. Today I will be presenting on examining the association in mortality rates between Hispanics and non-Hispanics and PM 2.5 and ozone in the United States. Here is the table of contents. According to CDC, the United States has the highest death rate due to the heart-related diseases, which is 23.1%, and the fourth highest death rate due to the chronic low respiratory diseases, which is 5.6%. PM 2.5 is a particulate matter which is less than 2.5 micrometer in diameter, can be released into the environment through fuel combustion for electricity, manufacturing processes, agriculture operations, road, building construction and demolition, and diesel and gasoline powered highways. Volatile organic compound and nitrogen oxide are the components of ground level ozone, which are released by gasoline, synthetic chemicals, dry cleaning solvents, paints, and household cleaners. PM 2.5 has been related to various diseases related to circulatory system, such as dyslipidemia, obesity, and breathing problems. Ozone has also been related to the development of lung diseases such as asthma and chronic obstructive pulmonary disease. We obtained circulatory and respiratory mortality data from CDC Wonder from year 1999 to 2018. And for air pollution data, we extracted from Air Quality Statistic Report by EPA. Mann-Whitney test was applied to compare the differences between the mortality rates for Hispanic and non-Hispanics by female versus male ratio. This table represents the median of county age-adjusted mortality rates for respiratory and circulatory system. The highest median mortality rate was observed among males, 105 per 100,000 for non-Hispanics for respiratory disease. Likewise, for circulatory disease, the highest median mortality rate was observed for 327.9 per 100,000 for non-Hispanics. This figure shows the comparative burden of PM 2.5 and ozone on Hispanics and non-Hispanic mortality rates. It shows the mortality ratio of female versus male by race. This is the special distribution of ambient PM 2.5 and ozone across the US. You can see here counties in the southwestern and northeastern have the highest concentration of PM 2.5 and ozone. Bigger cities like Los Angeles and New York cities are in those regions with high PM 2.5 and ozone. People from minority groups tend to migrate to these regions as a result of immigration and urbanization, exposing them to higher levels of air pollution. Also, as a result of urbanization, this area provides more opportunities for people. As a result, Hispanics and African Americans are more likely to settle there. The study represented a positive and significant association between exposure to PM 2.5 and ozone and higher mortality rates and development of other heart and lung diseases for Hispanics than non-Hispanics population. It eventually leads to a rise in medication usage, hospital admissions, emergency department visits, and premature mortality as health problems worsen among Hispanics. Owing to migration from rural farm jobs to urban city occupations, more than 90% of Hispanics now live in metropolitan regions, which have a higher concentration of PM 2.5 and other pollutants. For example, Hispanics have the highest adult asthma rate of any ethnic group in the New York City metropolitan area, which has the second worst traffic in the nation. This situation can prompt us to consider environmental justice, which refers to minority populations and low-income communities bearing disproportionately high health burdens as a result of environmental stressors. After considering by living in regions with higher PM 2.5 and ozone level, which results in higher circulatory and respiratory mortality rates for Hispanic as compared to non-Hispanic populations. The limitations of the study is that I did not take into the account confounding factors such as history of smoking, language barrier, lack of insurance, lack of access to healthcare, and high rates of poverty. I would like to express my deep and sincere thanks to Dr. Ilyas Kavaras from CUNY SPH.